Dr. Hoskins, what endometrial cancer data and studies coming out of major medical conferences are you most excited about? And can you speak to those gains and challenges or promises of emerging treatments?
Well, Mickey, I'm very excited. The SGO 2023 in Tampa, Florida, we had new data that came out from one of the NRG studies, as well as another study called the Ruby study. And both were looking at upfront carboplatin and paclitaxel with the addition of immunotherapy. And we saw improved progression-free survival. So that means when the disease is no longer there, how long are patients living without it recurring? And that has increased. So this is a big deal. And then one of the studies showed, again, the data is still maturing. So it's not, completely out there yet. So we still have to wait on it, but there may be improved overall survival. And that's kind of one of the study goals that we always want to do is improve overall survival. So I'm excited about that. There was also some new data looking at whether upfront patients with advanced endometrial cancer, whether they are treated with systemic chemotherapy versus systemic chemotherapy and radiation. And this is a long ongoing survival data that said patients basically did equally well with just chemotherapy alone without the addition of radiation. So that I think is very interesting because we use radiation and chemotherapy in patients with advanced endometrial cancer. That certainly doesn't mean that it's not an option. It just means that it may need to be more tailored and discussed with our radiation oncology colleagues. In terms of what the challenges are, I think immunotherapy is a game changer, but it's also what I use in terms of second line treatment. So now I'm using it up front. What happens if a patient recurs while on it? What am I going to do now? That's my question. What am I going to do next? And I'm not too worried because there are new, treatment options that are out. Again, they are not necessarily standard now, but they're ongoing in clinical trials. So I'm not too worried, but definitely some questions that cross my mind. My activation tip for this for patients is, if someone's diagnosed with endometrial cancer, am I a candidate for a clinical trial to be a part of this, new frontier, if you will, for endometrial cancer?